My name is Amy Vaughn, and I am the program manager for McDowell Access to Care and Health, also known as MATCH. So MATCH is a safety net network here in McDowell County that provides access to health care and other resources for uninsured low-income individuals in McDowell. Those individuals are linked to a primary care home, so they get free primary care for a year. In addition to that, we do a complete needs assessment with everyone that we enroll in our program. So if they need medication, if they need transportation, if they need access to food, if they need health insurance, all of those are things that our agency is able to provide in a whole person coordinated care type of model. So that's kind of how we operated prior to the COVID-19. So in the last couple weeks, of course, everything has changed. We've seen a huge uptick in needs for our folks. Not only needs of folks that are already enrolled, but also folks who are reaching out to us because they've either lost their jobs, they've been laid off, and now all of a sudden they're faced with very limited resources. They need to see the doctor, they may need food, they may need access to their medications. Just last week we had an individual who owned a small business, and because of the shutdown he's not been able to work. He's diabetic and he ran completely out of insulin. So we worked with him and a local pharmacy and some other programs that we have access to ensure that he had insulin. So those are the kinds of things that we're seeing more and more as we go through this pandemic. Our individuals that are enrolled in our program are hit harder. And one of the reasons that we see that is because so many folks that are in our agency are frontline workers. So they're either, in the food service industry, or they work for a small business, they've been laid off, they don't have access to health insurance, they've been experiencing reduced hours. So all of those things puts everybody in a world that they're not accustomed to. Well, for our program, all the folks that are enrolled in MATCH are uninsured. And that's for a variety of reasons. It could be they have, the majority of our folks do work. They just work in jobs where they're not provided health coverage. So like I said, fast food workers, grocery store workers, folks who are on disability, all of those people are uninsured. But now, because of the shutdown, there's a tremendous uptick in the number of people who have lost their health insurance. I would say we've probably seen at least a 50% increase in the number of people reaching out to us for services.
Just in the past 2 weeks or so?
I would say in the past 3 weeks. So the folks who were enrolled in our program have always relied heavily on food pantries to supplement their weekly needs. With the shutdown and COVID-19, we had so many of our pantries who closed simply because the volunteers were older, they didn't feel comfortable, they were at risk, they were a vulnerable population, and wanted and needed to go home and shelter in place, which that's completely understandable. But what that meant is that it was one less food resource for people in the community. So we worked with Heather to ensure that she had enough manpower to keep those pantries open, because that's vital for our folks. I think what's really interesting, though, in working at these pantries is, of course, you have people that come through every week, and you see your regular folks and you know those folks. But what we see more and more are the faces of people that you wouldn't expect to be there. I have seen people that I know and people that I've worked with come through the line, and I know they don't want to be there, and I know that they would not be there if they didn't absolutely have to be there. That's been one of the hardest things, and I think it's important for us to remember, and this kind of shows and demonstrates what we've always known, is that most of us are just 2 or 3 paychecks away from being in that line with everybody else. I think that's been a huge lesson that we all need to learn from. We are all just a few bad weeks of needing to access these same resources that we're in here trying to provide for everyone. So, as we move further into this, I think it's important for people to know that there are a lot of food resources right now in the community. Definitely check social media. We try to post regularly about the different events that are going on. And just a plug for our number, which is 828-659-5289. If there are folks who need a meal and don't have transportation, we have partnered with McDowell Transit to provide those meals to be delivered directly to your door. So, we hear a lot of people that aren't working that say they can't get to the pantry, they don't have gas money. But now through a really amazing partnership, we've alleviated that. So